Well, good morning, everybody. Thanks for being here. I'm Richard Chase from Wilder Research. I want to thank the same people that Mary thanked, but I also want to thank Jennifer Valerose. Raise your hand. She's back there, a co-author of the report. So we have over 900,000 kids aged 12 and younger in about 500,000 households, and you already heard that 3/4 of these households use some form of child care. 80% use 2 or more, including 41% who use 3 or more. A lot of cobbling together of different sorts of arrangements to meet their child care needs. So these hundreds of thousands of parents who use this child care and the 35,000 or so providers and teachers who are the providers of that, who care for the children, and the estimated 150,000 or so family, friend, and neighbor caregivers, they make up a major part of the Minnesota economy. And as we know, the children in those child care, in the care of those providers, they're the future economy. That's why we're here. That's why it's important to think about the children in child care. And it's also important, you heard several times this morning already about focus on low income. So 28% of the households in Minnesota with children under 12 and younger, are low income. 28%. For this study, we used 200% of poverty, which is roughly $44,000 for a family of 4. You heard the purposes from Mary for the study, to inform, develop, and assess child care policies and programs. And I'm grateful that the information gets used. And now we've got some updates. I went to a presentation yesterday where they used the 2004 results. Now they can start using the 2009 results. So this information does get used, and I'm grateful for that. The focus of the research was on low-income households, how they're doing relative to higher income. And then we also, because we have done this for the 3rd time now, we could also examine the trends over time. And remarkably, the results are similar to 5 years ago. So you could think, well, that might be good news, given we did the survey during sort of the heart of the recession and the economy was pretty tanked. In fact, we thought we might have to oversample for low-income households, but good news for the survey, bad news for the families, we didn't have to oversample because there were so many low-income families that were part of the households in Minnesota. So it might be good news that things weren't worse than last time because of that economy. But bottom line is they're the same, and so we still have the same issues about choice and opportunity and affordability that we had 5 years ago, and all of those affecting low-income families. And so we have to sort of roll up our sleeves and figure out what we're going to do to change that over the next 5 years. This was an address-based sample. So if you're into doing survey methodology, we used to do random digit dialing and random phone survey using phone numbers, but because of the growing use of cell phones, we now use address-based sampling. Sometimes there's a phone number associated with the address, sometimes not. We actually work with DHS to get phone numbers of low-income households that were in their databases associated with those addresses, because we wanted to include as many of those families in the survey as possible if they're part of that random sample. It's a statewide sample, stratified by region and within the metro area by county. It's any type of child care use in the previous 2 weeks before the survey, at least once in the previous 2 weeks. The households were screened to see if they had kids 12 and younger and if they used child care. But because of that, we could also know how many families with this age range actually use child care for one question about all households, and then we can move on and get more detail about the households that did use child care, and then actually more detailed information on a random sample of a child within each household. In the end, we surveyed over 1,200. It was a year-round sample, so we could look at summer versus school year, which to make it even more complicated. What I'm going to talk about today is the choices that people are making, choices in what they're using, with a focus on family, friend, and neighbor care, that kind of use, because of its, you already heard its primary care that people are using. I'll look at affordability, and then I want to pay special attention to looking at income differences, the 200% of poverty versus higher income than that, and then within that low income group, the families that have child care assistance using child care subsidies to help pay for their child care relative to low-income families that don't have that assistance. I'll also be pulling out information about, as you know, I do quite a bit of work in early childhood, so I have a special interest in the 0 to 2 and 3 to 5 population, so you'll see me talking about them quite a bit today, more than the 6 to 12-year-old group. And then I will be talking in code from now on, so FFN and CCAP. I'm not going to be saying all 7 words. Okay? So, as I said, we know how many kids are on child care because we asked about that question. So we know 3/4 of the households use some form of child care, but it's 2/3 of the kids this age are in some form of child care. And it's 82% of the 3 to 5-year-olds. That's the largest group, the age group that has the largest number. You see it goes down after that, so about half of those 10 to 12-year-olds are in some form of child care. And because of the definition in this survey of self-care, that also includes that. So there's so the child care is still primarily largely part of the younger ages. We asked 2 different ways of how parents choose the child care, reasons they're using child care. One was in their own words, and another one was asking them what's important to consider when they're choosing child care from a list. So this is in their own words. And as in previous surveys, location matters. That's important. It's either close to their home, close to their work, or on the way. That's a key reason. Also, cost is a key consideration, of course, but also quality. We found you get a sense from looking at the results and reading the open ends that there has been a lot of information awareness building in the state about school readiness and the importance of quality to achieve that. And you can see that in the language and the ideas that families have. This idea of quality and awareness about it does show up. And that is, again, an important reason why people choose childcare. The 4th reason that sort of emerged to the top 4 this time was this whole idea of trust. It wasn't quite as high as it was in previous surveys, but it rose to the level of those other 3 reasons. And quality is also an important consideration that parents, when they choose from that list, it's the top reason for choosing childcare, even higher than cost when you give them a list. Quality is an important consideration for choosing childcare. The reasons vary by type, though. So for those who use family, friend, and neighbor care, actually preference for care by a family member is up there, but it goes along with convenience and cost for families choosing family, friend, and neighbor care, or FFN care. For center-based care, they're looking for something, especially when the kids reach age 3. We found this before. They're looking for that experience outside the home with other kids, a structured environment, activities with a trained provider, that those social skills they might get with someone who's an experienced teacher. They're looking for that for their older kids. But center-based care is that structured activities is paired with convenience and quality. So people think about their choices of what they use the types of care differently, where quality plays in more for the center and cost, convenience, and family in more the nurturing environment fits in for the family, friend, and neighbor care. So speaking of quality, there's strong support in this survey, just like there was 5 years ago, for a quality rating system, such as being piloted through Parent Aware in several parts of Minnesota. All parents, 88%, said it would be helpful or very helpful. And then, especially for low-income parents, if you look at the top end of that range, 61% said it would be very helpful. That compares with 45% for higher-income parents. So people are looking for that. They hear it's important to have quality. Now they want to have help to find that quality. So quality is on people's minds, but parents can't always get what they want. And this is one of the key findings that's the same as last time, the choice gap. Overall, 29% of the families said they had to take whatever they could get. But look, it's higher. It's over 1/3 of parents with low incomes who say they had to take whatever they can get. No better than 5 years ago. But here's one of the best good newses of the survey, that choice gap actually did disappear for the low-income families using CCAP. Excellent. Clap your hands, Cherie. It's good news. Otherwise, so you'll see why it's important to increase access to CCAP. If this helps close the gap, we want to make sure that's happening. The So why people choose it and what they use, it does vary by the age of the child. So just for an example, this is looking at all types of care during the school year. So for those kids that are age 2 and younger, so almost a third are at home with their father or mother primarily. They're not in some sort of child care arrangement. And then of those who do use some form of child care, 3/4 are with an FFN provider, usually a grandmother for these younger kids. For older kids, it's often an older sibling, but for mostly it's grandparents. Then if you look at the 3 to 5-year-olds, here you can see that they're going more often into care, so that 18% of those are at home with a mother or father. And of those who use child care, 76%, 3/4 of them, are in some sort of center-based care. So you can see the same pattern we saw last time, is that as kids get to age 3, the parents say, we want to get them into care. I always think that the grandmother said that she had enough already, get this kid out of the, I've had enough, get them out there, out of the nest, go somewhere. These are the general, so it's because you look at the report, there's just summer versus school year, all arrangements versus primary arrangements. There's just, you can get buried in the data. This is the primary child care arrangements for all families, for all children. So family, friend, and neighbor care, still the most common type of care being used. Mostly relatives, mostly grandparents. Center-based care is the next most common. Those are the 2 most common types of care, followed by licensed care and these structured activities. But there's some differences by income, by whether or not families have CCAP. So there is an association with CCAP on the types of care low-income families are using. So if FFN is the primary arrangement and you have no CCAP, 61% of them are using that. But if you have CCAP, that drops to 31%. Why is that? Because if you have CCAP, you're more likely to be using center-based care, whereas you're less likely without CCAP to be using center-based care. So we find that CCAP, in addition to closing the choice gap, is an association with using and selecting center-based care. FFN care, it's like the mortar of the industry, or the caulk of the child care house, however you want to think about it. It fills in time when other care is not available. It's the most common type of care for all non-standard times, whether it's before work hours, after standard work hours, overnight, weekends. One interesting finding, I think, that relates to the economy is that there was a drop in FFN use in the early mornings and on weekends, which may be a sign that parents didn't need it at that time because maybe they were working less, or one parent was working less, or there was part-time care or so on. So that was another that was one of the key things that showed up as an economic consideration. This is a picture that says a lot about patterns in what types of care kids are in by age. And you can see that for the blue color, that's the FFN use, that it's primary child care use. It's very similar for the 0 to 2 and then the 6 and to older groups. And you see it's lower for the 3 to 5. Then you look at the middle color, the gold. There you see licensed family child care. It's highest for the youngest age group, and then it keeps dropping, lowest for the oldest age group. So it's the 0 to 2. So again, I think parents are looking for family members for their kids 2 and younger, or sort of more a home setting for that group. That's sort of what is a common thing they're looking for. But then look at center-based care. Again, very similar rates for 0 to 2, 6 to 9, 10 to 12, but that's where you see most of the 3 to 5-year-olds is in that center-based care. If you think about early care, child care as early care and education, what about the education part connected to the care part? What if think about this as a learning opportunity for children, and how are we doing with regard to those learning opportunities? Again, let's look at 2 age groups, the 3 to 5-year-olds first. So again, 1 in 5 roughly have no care outside the home. They're with their parents. We want to make sure that is a great place to be for those kids. It's a stress-free environment. It's enriching and so on. Those parents are supported. And for a quarter of those kids, they're in FFN as their primary arrangement. So if you can see the preponderance of 3 to 5-year-olds, those parents are getting them into center-based care. If these environments aren't equal to that, then these kids will be at a disadvantage compared to those other kids. So we have to make sure that if they're at home with an FFN or a parent, that they're getting the same level of sort of development as they are getting outside the home. And this is the only slide I have around the older kids, the 10 to 12-year-olds. But this showed up last time too, is we have a large number of 10 to 12-year-olds taking care of themselves during the summer and after school during the school year. So these kids, again, they're not in the same programs where they can get leadership skill development, where they can get social skill development, they can learn how to get along with each other, they can learn different sorts of skills. They're at home doing who knows what. So again, and the primary reason for this is due to cost. So what more can we do to make sure that all these kids have opportunities for learning opportunities that other kids have? And then more good news for the CCAP program, that it looks like it also is associated with quality, associated with closing gap of choice, associated with center-based care, and associated with parents' understanding of choosing quality care. That they rate their arrangements higher, that they say they have a place that prepares their kids for school, that they're using these curriculum and tracking learning, and that it's a good place for their children to be with regard to quality. And they also say that when they report what's important to consider when choosing childcare, they talk about the special training of that provider. That's why it's important. That's what the CCAP parents are saying. So this association with quality is another good sign for CCAP. How are we doing on affordability? Roughly, rule of thumb is that 10% of your income, if you're paying for childcare, would go for childcare. And as a state, we're doing pretty much that. It's about 12% overall. But look at the lowest income group, the $20,000 and less. This is the percentage of their income going for childcare, 3 times what is considered to be affordable. This is no different from last time. So the extent to which the cost burden is greater on the lower income families is a main concern. In fact, 60% of low income families do not pay. 60% pay for childcare, 40% don't. That's, I think, another sign of affordability, because they can't find something they can afford, so they more likely choose free care through their family, friend, and neighbor caregivers, or with no care for their children who are 10 to 12. For those who use family, friend, and neighbor care, it's free for 62% of them. So there's 38% of family, friend, and neighbor FN providers that are getting paid to do that for their relatives or friends. All right. What does this tell us about this persistent issues with regard to choice, opportunity, and affordability, especially as the disadvantage of the low-income families? You know, I do other work in early childhood, so I've been thinking about what does this mean related to that, and especially the state's goal that all kids will be ready for kindergarten by 2020. What are the implications of these findings for that? Well, and how are we going to achieve that goal unless all families, especially low-income families, actually have meaningful choices concerning where they can, what kind of child care they can use, and meaningful choices of quality care they can afford? So first, it has implications, I think, regarding FFN care. That first we have to figure out how to fully integrate FFN into not just the child care system, but the early childhood system. Because think about those 0 to 2-year-olds. That's where most of the FFN are. And if we're concerned about their early development, their brain development, we have to be sure that those caregivers are okay. 5 years ago when we did the FFN, we did an accompanying survey of FFN providers as one of the only, I think the only one in the country. And we didn't do that again this year. But prior to that survey, you know, FFN were demonized, you know, substandard care. And then it was moving, we should think about FFN not as a strength. We should think about, now then we started to idealize them. Well, now we have to sort of get real, you know. I coined this phrase, like, FFN are us. If FFN are us, not all of us are good caregivers. And especially when it comes to stressed out low-income families. So, for example, if all of our policies were aligned with our goal of all kids ready for school, we would have a 3-generational approach for targeted home visiting. where those grandmothers who are caring for babies during the day would be getting the home visit, not their mothers who are probably gone during the day and just at home to sleep and put their kids to bed. So we would think about programs focusing on the development of the child as the purpose. We would align our policies and our programs with our goals. Second, so quality rating system. Strong support for it in this survey. But we can improve, in all the efforts to improve awareness about quality, the ratings of quality, and the improvement of quality. Wonderful. That's what we should do. But as you saw, as what I said in the morning paper, if that doesn't also connect with affordability and parents can afford to use that quality, then it's all pointless. And what I'm afraid of is that we'll put all the effort into the rating and not as much into the access. I would like us to be called not a QRS system or a QRIS system, but a QRAS system, quality, rating, and access system. So we build it right in, that it's interwoven in the policy, that improving quality and rating it is totally interwoven and hand in hand with access to it, that we can't disconnect them. We have to say them all at the same time. Otherwise, we are going to get one without the other, because the other, access, costs a lot more than that part. So QRAS, or we can call it QRIAS if you want. All right. Then last, again, aligning policy with our goals. CCAP. We saw the value of CCAP in this survey. We have to connect more families to CCAP first. But then we also have to make sure that CCAP is as focused as much on child development as it is on parenting employment. I love Barb Yates's quote in the radio yesterday. When parents lose their jobs, we don't kick them out of second grade. But if they're on child care assistance, we kick them out of preschool. That's flat wrong. So what can we do to make continuity of care part of CCAP policy? Whatever waivers, whatever difference we have to do, we can do that. We should look in how we can do that. So, I think I'm done.